Good afternoon, and welcome to Mercy Health Muskegon's Healthcare Spotlight, where each week Mercy Health will bring you important and helpful information that helps you become more informed and involved in your healthcare decisions. We believe that carefully listening to and encouraging you to take an active role in your healthcare is just as important as having access to our specialists who use the latest technology. At Mercy Health, we offer compassionate care, award-winning expertise, and the latest in technology, all in an inclusive, faith-based setting that honors the sacredness and dignity of every person. At Mercy Health, it's not either or, it's all of these and more. It's Mercy Health. And my name is Erin Patrick. I'm your host for today. I'm the Regional Manager of Public Relations and Communications with Mercy Health. And today we have the privilege of talking with Dr. Jason Bennett, who is a urogynecologist with Mercy Health. So thank you for coming. We are so excited that you're here. And we have a lot of important topics to cover. So I would like to just get into really how you became interested in coming over to the Lakeshore with your patient care services and what you do as a urogynecologist.
Sure, Aaron. Well, originally, I've been practicing in Grand Rapids for about almost 15 years now, and I've recently joined Mercy Health to be their regional urogynecologist. Mm-hmm. So we can actually expand some of the services that we've been doing in Grand Rapids to the Lakeshore, particularly in Muskegon and Ottawa counties, and be able to reach the patients that traditionally had to drive all the way to Grand Rapids to get these services.
So why would a patient need to see a urogynecologist? What is one of your, let's say, your top three problems or diagnoses that you see patients for?
It's interesting. If you think about being a woman like you are, as you age, the potential for you developing urinary incontinence or pelvic organ prolapse, which means as your bladder falls out or the uterus falls down, can be as high as 40%. In some ages, like when you reach your 80s, it's even higher.
Right.
So you're talking about a substantial more amount of the population. This is actually more than diabetes, more than back problems, more than asthma.
Okay.
And there was a study that was done actually in Europe that looked at women as they aged, and the important thing is only about 25% of women that leak urine will actually talk to their doctor about the problem.
Right, because you can imagine it might be kind of embarrassing.
Oh, it's totally embarrassing.
You know, it's a common healthcare issue, and probably you might even talk about it with your friends, but it's kind of silly that we feel embarrassed to talk about it with our doctor.
It is, and the interesting thing, the people that actually were the more severe types of incontinence, usually the people that smell like urine, they don't go out, they don't go to church anymore because of that potential bomb of leaking through their clothes. Only 50% of those people talk to their doctor.
So, it really creates a barrier in their lifestyle, too.
It does, and it's a kind of a horrible thing that it increases the amount of depression in their lives. They stop doing things that they typically do, and being able to treat that is wonderful because it gives people their life back.
Mm-hmm. So how are patients referred to you? Is this typically through them seeing their family physician or their general practitioner first and maybe disclosing this information? Is that kind of how you are able to connect with these patients? Sure.
We get patients from kind of all different aspects. A lot. I specialize in certain surgical procedures that a lot of regular gynecologists don't do. Mm-hmm. So we get a lot of referrals from gynecologists that don't want to deal with the severe prolapse. Okay. But we also get referrals from primary care physicians, PAs, nurse practitioners. Mm-hmm. So it can be directly. And to tell you the truth, one of the good things about this program is educating not only people with the problem, but physicians and care providers to say, you should ask these problems because it's so prevalent in the population.
Mm-hmm. Okay, so let's talk a little bit about just your experience. I saw from your CV that you did your undergrad in Kalamazoo at K College, right?
I was a K College grad.
Okay, I was a Bronco grad. So
oh, that's terrible.
Close on campus there. I know we shared some sidewalks, I think, over on the other side of campus. But so you did your undergrad at K College. What made you decide to go into medicine?
Medicine is one of those things that you can actually impact people's lives in a really positive way. Mm-hmm. Originally, I actually was going to be a marine biologist. I wanted to do marine biology more than anything. Mm-hmm. And something along the lines clicked that medicine was kind of the direction I wanted to go.
Mm-hmm. And so after Kalamazoo College, where did you attend medical school?
I went to Michigan State.
Okay, so you're a Spartan.
I am a
I'm
Spartan.
okay with that. I don't have any family members that have graduated from U of M, so I can deal with the green and white.
Well,
And-
it's interesting. My children are more huge Spartan fans than I am, and they've never gone there.
Right.
But just through elementary school, I think that the teachers start training kids to be either a U of M or Spartan fan really early.
It is. It's a house divided in those schools sometimes.
Yes.
You've got one teacher that went somewhere or had a husband that goes somewhere, and it can be pretty scary territory in there sometimes.
Well, luckily it worked out at mine because my kids decided to be brainwashed for Michigan State only.
Okay, so
and I went there, so it was great.
We've got them all set.
Exactly.
Yep. Okay, so College of Human Medicine at Michigan State,
Yep.
who I know we're great partners with too. So, and after you graduated, where did you do your residency?
Actually did it in Grand Rapids.
Okay, and then how did you come to specialize in urogynecology?
Urogynecology is one of those things that a lot of people don't like to do. If they think of obstetrics and gynecology, the delivering babies and that type of thing is where everybody's heart breaks, and they love to do that. But the positive impact that you can do in people's lives when they don't leak as much or leak at all,
Right.
Deal with their urinary or fecal incontinence and take it away, that was just something very special to me, and that's what kind of drove me to kind of force my education in that direction.
Okay.
And I've traveled all over the country and the world learning new techniques as well as teaching some of these to other people.
So tell me a little bit about your research and your teaching.
Sure. Well, we've developed a research department, and we've done anything from menopause, heavy periods, fibroids. But traditionally, our kind of focus has always been urinary incontinence and pelvic pain issues.
Okay.
One of the cool research projects we've been a part of is we're actually, with the mesh issue that's come out with slings and fixing urinary incontinence, it's created a lot of fear in people.
Right. And you've seen those commercials, those really scary commercials on television as well about the mesh. And
it is, and
Yes.
it is scary for patients. And even though there's some aspects, mesh can still be used in a safe and actually a very helpful way. One of the new treatments that we're actually helping develop is we can actually biopsy some muscle out of your leg.
Okay.
And it's interesting, there's a bunch of different muscle cells. We take the lazy one, which is interesting. We grow that out and we re-inject it in the urethra.
Okay.
And it actually starts growing and
That's amazing.
improving the strength of the urethra. And over a few months, it can be fairly effective of stopping leaking with coughing, laughing, sneezing.
Wow. Which are probably, the instances where it's probably definitely going to happen.
Yeah.
Those are some, issues I know people, especially older people that I know, they joke about. They say, if I sneeze, if I cough, if I laugh, I've got to be careful.
But that's that prototypical soccer mom. She goes out, she gets on the trampoline with her kids
Sure.
or is playing out in the fields and leaks.
Yep.
And it doesn't have to be a large amount to be embarrassing. And those are the things that we can actually, maybe not necessarily cure, but we can substantially improve them.
Well, I have some other areas of expertise that I'd like you to elaborate on.
Sure.
Because people in our community that are listening right now probably understand issues with bladder, whether it's they're a man or a woman. But specifically for women, you have expertise in pelvic organ prolapse and reconstruction. What is that?
It's kind of a fancy word for when your bladder falls or you start having problems with bowel movements getting caught.
Okay.
If you think of the vagina really is kind of like a room. And the ceiling is where the bladder is, the floor is where the rectum is, and at the top or the front part of the room is where the uterus is. And say there's water damage in the building above us.
Sure.
And what happens is the girders that are holding up that ceiling get wet, and the stuff in the ceiling actually starts falling down.
Right.
And that kind of what happens with bladders. And anybody that has vaginal deliveries, is at risk. Age, going through menopause. Genetics plays a huge role in this.
Really? I wouldn't have thought that would have...
Well, think about it like this. Why do some people get stretch marks and some people don't? What happens is the belly stretches out, and for something, the connective tissue in the skin starts breaking down, giving you stretch marks. And some people's connective tissue is better than others. And there's actually a lot of research right now going towards trying to figure out who's at more risk than not.
Okay.
Because I've seen people that have had 10 children and don't have any prolapse. I've taken care of people that are in their 20s that have the uterus prolapsing right to the opening of the vagina.
So yeah, definitely genetics would
Genetics
help
plays a huge...
explain that. Yeah, that difference.
But if you have larger children, you have episiotomies, operative deliveries like forceps and vacuums,
Sure.
all increase your chances of having these problems. And again, it's so prevalent. It's like that old adage, if you go to doctor school or lawyer school and the person says, well, look to your right, look to your left, somebody's not going to be passing.
Sure.
It's look to your right, look to your left, somebody's going to have incontinence because it's almost 50%.
Wow.
Yeah.
That's kind of a cool analogy.
Yeah.
People easy to understand. So let me talk about also, there was something cool that I saw on your expertise rundown here with the Da Vinci robot. It says that you've taught courses in California and you've had physicians from almost half of the states in this country come learn about robotic
Sacrocolpopexy.
You take it from there, yes.
Yeah. It's just a fancy word. If you think of the sacrum, which is your tailbone, it's got a front and back part where we're actually attaching our meshes to the front part of that sacrum. The colpo is the top of the vagina or the cervix. So when that cervix kind of falls down, we can actually do a procedure that lifts that back up. And we do it actually all robotically.
And so for the patient, what is the recovery? What is the timeline to have something like that done?
Well, it's interesting. This procedure's been around since the 1970s.
Really? Okay.
The difference is at that time you had to make a big incision to do it.
Okay.
What the Da Vinci robot has given us is to be able to do something that we had to get our hands in there and open somebody up, which actually has substantial pain issues afterwards.
Right.
To go to, something that's probably a 2-foot incision down to incisions about the size of your thumbnail.
Wow.
So pain is reduced, getting up. Because when people have a lot of pain, they don't get up. They get more blood clots. They get more pneumonias.
Right.
So we can eliminate all that stuff or substantially reduce it, maybe not eliminate, and give them a better quality of life.
Right.
And the success rates are very, very high. I was fortunate enough to be recognized early on, and we've been able to teach a lot of physicians. We've had physicians come from 20 to 26, I think, different states.
Wow.
As far as California and Montana. And it's kind of neat to be able to do that because they still will call you with questions and ask.
Right.
We've done courses about sacrocolpopexy, really teaching not only the procedure, but how to make it safer for patients and give them a better quality of life.
Now, for that type of procedure, is that done here in Muskegon, or do they go to Grand Rapids for that procedure?
Muskegon and Grand Rapids both have access to the Da Vinci robot.
Okay, so if a patient was seeing you here in Muskegon and was comfortable with you, and you had a recommendation that they would have that procedure done, they could stay here?
That's our hope,
Lakeshore?
and that's what we're trying to develop is the ability to do that.
Okay.
And particularly with the when the new hospital is done, which is kind of cool to watch it being built.
Oh, it's so cool. We've had some guests on the show where we do updates, every couple of months on what's happening. So tell us how you fit into that picture.
Well, our hope is once that new hospital is built and they have another robot available, we'll be able to offer more of these services there. But so we'll be able to do the same procedures that we're doing in Grand Rapids as well as in Muskegon.
That's just awesome. I'm so excited, and not that I have anything against Grand Rapids. I'm looking over at Bill because the guests that we have on this radio show, we do this show every single week, and we have a different expert on for various topics. I mean, sometimes for construction, sometimes for, community outreach, and then, obviously today, urogynecology. But the cool thing about it is that everybody that we have on here is bragging about what we can do in Muskegon. I mean, this is a Muskegon radio show, and with this new hospital being built, I think people in our community are going to want to stay here. They're not going to say, oh, this hospital is aging, the building is old, I have to go here for this and over at this hospital for this. We're going to have everything centralized along with your services. So I'm really excited to hear that that's going to be upcoming.
Well, I think that's the difference between, Mercy Health and some of our competition is that really we're trying to bring the services to the patients, not just bring the patients to a central hub where everything gets done.
Right.
Instead of the more factory kind of feeling, we really want to be able to give it to them where they live and give them the high quality services that we can do in some of the bigger cities.
That is awesome. Also, I wanted to talk about the courses that you've been teaching on sacral neuromodulation.
Sure. I have done courses. It's a special technique where we treat urinary incontinence, and actually it can help fecal incontinence too.
Okay.
When you're looking at these problems, there's different tiers of how to fix these. So, the first line therapies are typically like, if you drink a lot of coffee, you're going to go to the bathroom a lot.
Right.
Sometimes switching to just low acid coffee can reduce the amount of times you go to the bathroom.
Right.
Second line, and also physical therapy is a big part of that. If we can teach you how to do those Kegels.
Right.
Now, Kegels are actually kind of hard to do. I've had people that are gymnasts that can't find their Kegel muscles. So sometimes getting in a organized program can be very helpful, and 60% of people can have an improvement with Kegel muscles.
Really? Okay.
Yeah, but the problem is that once you get good doing it and you start improving, people are fundamentally kind of lazy, and what happens, they stop doing their Kegels, symptoms come back.
Okay. So, it's something that you have to maintain
for the
as
rest
a
of your life.
practice for the rest of your life. Okay.
And if you do that, you can go through life without having a surgery or, being poked or prodded at all.
Sure.
But second-line treatments are the ones people are more familiar with, like Ditropan, Detrol, the medications that help with overactive bladder.
Right.
The problem with those medications is that 40% at a year's time will still be on the medication. 60% of those patients will actually stop because of side effects.
So what are some of the side effects of those drugs?
Dry mouth, dry eyes, constipation.
Okay, so it's definitely, you're flipping the coin on that one. Get rid of this symptom to gain another.
Exactly. You're trading one problem for another. So that's why a lot of these third-line therapies, like InterStim, which is this neuromodulation.
Right.
And there's different ways of doing that. The first way is something called tibial nerve stim. If you think about where your tibial nerve is, if you feel the ankle, the inside of the ankle, there's a little nerve that runs along that little bump bone there.
Okay.
And that nerve, if we actually stimulate that, can go all the way up to the sacrum where your bladder's controlled.
Oh, wow.
And can reduce it, the amount of urgency, frequency, and potentially even fecal incontinence.
So the nerve starts at the ankle and runs...
Well, it's kind of like how people can have referred pain.
Yes.
Sometimes when they have like a laparoscopy, they get gas pain and they'll get a shoulder pain, but it's actually irritation of the diaphragm. This nerve kind of coalesces or kind of comes together with the nerve that controls the bladder. So if we stimulate that, there's actually extra stimulation that goes to the nerves that control the bladder.
Okay.
And it reduces the irritation of the bladder.
Wow.
It's kind of cool.
Interesting.
The next step is InterStim. InterStim is actually like a heart pacer for the bladder.
Okay.
If you think about a heart, it can either beat way too fast or it can beat way too slow.
Right.
And what we do is we put a little electrode or wire by the nerves that control the heart, and we can actually slow it down or speed it up.
Right.
InterStim is very similar to that. We put a little electrode in the tailbone, and it has a little battery pack, and we can actually speed up the bladder. So if certain people don't empty their bladder well, and that can be because the bladder is just not contracting well, we can actually speed it up and get them to empty.
Wow.
So if they're beating too fast or their bladders has urgency frequency, we can actually reduce that.
This is just very interesting to me. I have not really gotten much exposure to this topic, and I'm guessing that our community hasn't either. So I'm really excited that you're sharing all this information with us today. This is very exciting.
Well, the nice thing about InterStim is we actually just published, now as part of the research in this, a 5-year data and how well InterStim does over time.
Okay.
And that just got published in the Journal of Urology last month.
Wow, congratulations.
Yeah, that's kind of a
awesome.
cool thing.
So what did the data show?
It actually showed that compared to medications, because the study was looking at medications versus this therapy, that it actually was slightly superior to medications.
Okay, and probably with less of those side effects that you were mentioning.
Exactly, Erin. If you can get away with the side effects, it becomes a better therapy because you're more likely to stay with it. And it's not something that you have to eat like a medication. You're not going to get the dry eyes, dry mouth, constipation.
Right.
And for that and people that have those problems, it actually has been a lifesaver.
That is so awesome.
Yeah.
Yes. Okay. Well, great. I also see that you've presented at the OGS Society for Urodynamics and the Female Pelvic Medicine and Urogenital Reconstruction meetings. That sounds very official. can you tell me a little bit about what you did at those presentations?
Sure. So one of the presentations that we were talking about is the potential for infections with putting InterStim in. Mm-hmm. And some studies have shown, particularly with colorectal, because that therapy could use for fecal incontinence also.
Okay.
Was the infection rate was, higher than we'd like to see, which is, anywhere between 6 and 7%. Mm-hmm. With our data that we just published, we were actually less than 3%.
Wow.
So we published that data at SUNA, which was the one, and the other one was actually a new medication for treating nocturia, which is basically a fancy word for go in the bathroom at night.
Okay.
The interesting thing is that a lot of the medications don't treat the nocturia. And when you go to sleep, your brain and hormones function differently. Mm-hmm. And a lot of times you'll actually produce a lot more urine at night.
Okay.
And as you age, your ability to sleep through these things.
Through the urges and things like that. Yeah.
Things that in your 30s that you wouldn't wake up for, mm-hmm. in your 50s and 60s and 70s, you're more likely to.
Okay.
So it was actually a new medication to try to change some of those hormonal balances at night so people could get up less.
Oh, that's really interesting. And I guess, you figure if you're taking a medication that you're covered. So when you're not getting the benefit of that medication through the nighttime, which is half your day sometimes, it's probably something that, maybe you wouldn't even realize is happening when it's happening, and attaching that to just being, having your brain go into that REM sleep and that cycle and not being able to control those things.
Well, the hard thing, too, is that people that get up at night multiple times, because as you get into your 50s and 60s, getting up once is pretty normal.
Right.
But if you're getting up more than that, what happens is it destroys your sleep pattern. Mm-hmm. You're more likely to have emotional depression. You're more likely to have issues with memory, because sleep is so important to how you work the rest of the day.
Right.
So we're putting a lot of effort and try to fix how people sleep. That's why we have these sleep clinics and that type of thing.
Right.
But it's not just the oxygen content. It's some of the ability to not go to the bathroom will vastly impact that.
Wow.
Yeah.
Very, very cool. So now that you are open and ready for new patients in this Muskegon facility, what would you recommend if somebody is seeing their gynecologist or their family physician and they're having issues? What's the first step? How do they start that conversation comfortably?
I mean, that's a great question, because we have a wonderful amount of doctors here, both with primary care as well as the gynecologists here in town are fantastic. Mm-hmm. But, like we talked about that study before, part of the problem is just talking to their doctor about it.
Right.
Opening that conversation, and they can talk about different treatment options that are out there. And if they get to the point where they're not comfortable, I'm happy to see them too, and they're happy to refer those to somebody like me that deals with some of the more complex procedures and how to fix these.
So if a patient comes to you and says, here are the problems I'm having, here are the issues I'm having, what kind of methods can they expect you to recommend?
My kind of philosophy about a lot of this is giving the patient choice. Mm-hmm. There's lots of different treatment options, and each has pluses and minuses.
Right.
And it's my job to educate them about what's out there. Mm-hmm. It's their job to figure out what's the best option for them, both surgical and non-surgical options that are out there.
So just keeping with our mission and giving them that patient-centered medical experience, really, that Mercy Health is kind of known for.
And that should be from any physician should be able to do that.
It should, but I think that we have a reputation in the community about always putting the patient first. And so what you're saying is making sure that you're giving them all the options on a menu and letting them kind of decide what they think is going to fit best into their lifestyle.
Exactly.
Anything else you want to talk to us about your practice, either in Grand Rapids or Muskegon?
I mean, I think one of the other things that people are hard to talk about is like pain with intercourse and that type of thing, and particularly with the mesh issues that are out there now. Mm-hmm. I mean, in the last few years, we've been bombarded by mesh, and we actually, as a center, have a history of removing mesh for pain and issues like that.
So you've gone through the procedure of having the mesh put in, and then because of issues, you're needing to have that removed by a physician. So what was the big push with mesh to begin with? I mean, was it just kind of the industry standard for treatment for a lot of these things? Or
Well, it came from abdominal hernia mesh when people would have a hernia in their belly button,
right?
For example, and they would put a synthetic material to reinforce your tissue because your tissue just wasn't strong enough to repair itself. And that worked, fairly well. So we thought that, in our way to try to improve, our procedures, because if you look at a traditional cystocele repair, fixing that bladder, up to 40% will fail in the first few years.
Seriously?
Yeah.
Wow.
So, this thought with mesh and using different materials to reinforce that connective tissue that's failed is really our desire to try to help people stay healed faster and longer and give them better surgical outcomes.
Right.
So some of this actually came from that ability. And during the late 90s, they came out with the sling, which revolutionized the way to fix urinary incontinence. From going from a procedure that was an inpatient big abdominal thing to something that could be done in the office. And we used to do slings in the office under just local anesthesia.
Really? I did not know that.
So those work so well, it'd have an 80 to 90% success rate. Why not, if a little piece of mesh would fix incontinence that much, why not put a big piece of mesh under the bladder to fix that?
Right, but you're saying that this has caused, pain with intercourse and some other things, so...
If it had, there's a potential that the incision that you make to put the mesh in to hold the bladder up, the chance of that mesh working it through that incision can be as high as 5 to 16%.
Oh, wow.
So if you have an erosion of this material, it's like sandpaper, and that's what can cause pain.
Oh, my goodness.
So it's one of those things, if people have had those issues, we have that expertise to remove it. We've had people from anywhere from the UP to Indiana removing pieces of mesh, and we're known for a center for doing that. Okay,
so for those of you listening out there, if Dr. Bennett is talking about options, we've covered so many today. So please make sure that you're visiting your primary care doctors first. But if you have additional questions or you need more expertise in help with bladder issues or incontinence, if you have a mesh implanted and you're having pain, make sure that you visit his office. Now, tell us a little bit about where you're located here in Muskegon.
Right now, we're at the Bladder Clinic, which I think is actually in Norton Shores, just south of Muskegon. And we're going to be opening another office in Grand Rapids fairly soon. Okay. So we have, again, that regional-wide reach and be able to give patients the treatment that they need in the communities that they live.
That is awesome. Well, thank you so much for joining us today. This is a really interesting topic. And of course, if you would like more information on the Bladder Clinic, Dr. Bennett's expertise, you can visit www.mercyhealth.com. And I do understand that you've got a birthday coming up. Would you like to provide a shout out to your son who just had a birthday on July 30th and your daughter's birthday that's coming up this weekend?
Yeah, I'm getting older and older myself, and I currently have now a 10-year-old with Rohan, and he was just in Montana for his birthday, and my daughter Elena, who's turning 14, is going to have a birthday this Sunday. So happy birthday to both of your kids, and thanks again for joining us. We are Mercy Health, bringing you important, helpful information that should become more involved in your healthcare decisions. We believe that carefully listening to you and encouraging you to take an active role in your healthcare is just as important as having access to our specialists who use the latest technology. At Mercy Health, it's not either or, it's all of these and more. It's Mercy Health.